everybody, and welcome back to Friday Facts.
Hi, it's been a long time.
It has been. I have a confession to make. So first of all, for all of you, I'm Dr. Alice Barsoumian. I'm one of the infectious diseases physicians here at BAMC.
Hi, and I'm Dr. Elizabeth Markelz. I'm also an infectious disease physician here at Brook Army Medical Center.
And my confession is I did a Friday Facts without you while you were on vacation. I know you've seen it, but I just wanted to confess in front of everybody. But Dr. Donahue and I really wanted to get out some information about RSV strategies coming into the season for respiratory syncytial virus.
Yes, I know. Well, I'm sorry I missed out, but I honestly, I'd rather have been in Spain.
Well, I'm glad we're back together now. And today we wanted to bring up the topic of seasonal immunizations and coming into cold and flu season. So influenza A has been around and we've noticed an uptick in some cases. It's customary for this time of year, and we do get early warning about influenza in our patient population because of all of the surveillance that we perform.
Yes, so I think it's an important time as we're finishing up with the summer season, heading back to school. You may have noticed that kids are getting sick. You may have noticed some of the sore throats, runny nose. And so, yes, flu season is approaching. We are seeing the cases, so I think it's a good opportunity for us to remind everyone that there is a flu vaccine.
Yes, and so this year's flu vaccine is already available at some retail pharmacies. BAMC gets their flu vaccine shipment filled in another way, and we get our vaccines around October. So for those of you who'd like to get their flu vaccine now, we can have you check the TRICARE website to see which retail pharmacy offers it near you.
Yes, I know that this weekend, although my kids aren't super thrilled, we're all going to get our vaccines because, again, it's circulating and I'd rather just get the flu vaccine now.
Yeah, and whenever you get it, it is recommended that you get it before the end of October to have maximal protection at some of the peaks during flu season.
Yes, and so go out there, get your flu shots, make it a family event. I'm certain I'm going to be doing that. Since we're talking about flu, and we're seeing flu, something else that we're also seeing a lot of lately is COVID.
Yeah, and I think some of you guys have already noticed it and brought some of those concerns to us. So if you've been paying attention, or maybe you've seen it in the news, the seasonal COVID booster was FDA approved last week. The vaccines are not widely available yet, and we're expecting them to become more widely available in the next 1 to 2 weeks. So those will be available at many retail pharmacies are already planning it and booking appointments for COVID vaccines. You can get your COVID vaccine seasonal booster at the same time as your flu shot, or you can separate them. I like to recommend my patients do whatever is most convenient for them.
Yeah, so for me and my family, we'll probably get the flu first since it's now available. And we were thinking, at least for me, I have some travel coming up in the fall. So I was planning on probably getting it sometime late September, mid or late September.
Yeah, I'm headed for mid-September. I have some travel and some events before that. I really want to be protected before I see all of these people and mixing and do all of that travel. I think that's probably going to work out best for me. I am going to wait. For me, it's a little bit more convenient because my kids hate shots, just to get them both at the same time. But what I'll probably do is do me and my husband separately and then take my children.
Yes, same. I mean, they're going to probably also not like that I am separating it, but I figured
You fight the battles you can win. You know, I mean, sometimes, so we'll have to see. There will be opportunities for you and your family members to get immunizations available for flu and COVID this year at BAMC, and we'll update social media when they're available.
Again, so I think it's a really good time to highlight that, you know, like flu, COVID mutates, so we anticipate that pretty regularly there will be newer versions of the vaccine, probably similar to an annual flu vaccine like we do. Again, that's just to make to be able to give you a vaccine that provides the most efficacy for you and your family.
There are some other respiratory viruses that are circulating now. We don't have a ton of vaccines available, widely available for them. So we always like our patients and our colleagues to remember, if they're feeling poorly, then they should just stay home.
Right, yes. So no need to, be a hero, show up. If you're feeling sick, have a fever, stay home. and get back to work or your events when you're feeling better.
Yeah, I mean, it's that time of year with the school. There are some vaccines available for pregnant women and people who meet certain and other non-pregnant adults over the age of 60 for respiratory viruses, respiratory syncytial virus, as Dr. Donahue and I went over, but also pneumonia shots are bacterial infections that sometimes increase at this time of year. Talk with your doctor to see if you're a good candidate for a pneumonia vaccination too.
Yes. So also think about just the other things that you can do. Hand washing. It's never wrong to wash your hands. Wash your hands frequently, and think about that when you're around other people.
Yeah, and this is definitely the time of year where I put my mask back on when I'm traveling.
Yes. So think about that. Think about when you're visiting immunocompromised people, elderly people. If you're feeling sick, just think about the risk to them as well.
Well, I'm really excited for the fall. I can't wait to see, what's coming. I'm going to tell you what's coming. We went to a supermarket yesterday to pick out a birthday cake for my son, and we saw lawn decorations in the shape of a turkey.
Oh.
And he lost it. He said, I can handle the Halloween pumpkins, but I can't handle the turkey.
Yes. We're so eager to move forward. So I am just happy that there were some evenings where it wasn't over 100 degrees recently, where I felt a breeze and I felt like, oh my gosh, I'm outside at soccer practice and I'm not drenched in sweat.
I know. It's almost too good to be true. Well, all right, that's all we have. And so until next time, keep taking a look at BAMC's social media pages to figure out when you can get the vaccine with us. But don't wait for us. Try and get the vaccine when it's most convenient for you and your family. You certainly don't want to miss an opportunity.
Yeah, absolutely. And we'll certainly be advertising our children's fair, which is usually a popular event for vaccines. And we'll also take advantage of having vaccines available at our Retiree Appreciation Day.
Yeah, I'm looking forward to both of those events. All right, everyone. Take care.
Bye.